Gentlemen, quick question. Have you been waking up tired even after a full night's sleep? Feeling your energy leaking away? Noticing mornings that aren't as vital as they used to be? If any of that hits home, stay with me for the next few minutes, because what you're seeing isn't always just aging. It can be a sign your nightly recovery system needs help. I'm Dr. Mia Carter, and today we're going to talk about a simple, science-based way to improve sleep, morning energy, and yes, vigor and intimate confidence, starting tonight. No hype, no risky procedures. Just practical steps grounded in physiology and decades of clinical experience. Why nighttime matters more than you think. People often think sleep is passive. You go to bed, you wake up. But night is when the body repairs itself. Two things happen that are critical for male vitality. Hormonal rhythms restore balance, and blood flow systems that support morning erections regenerate. Your mitochondria recharge. In other words, good nighttime recovery is the foundation for daytime energy, mood, and intimacy. When that recovery is broken, whether from stress, poor sleep architecture, or simple nutrient gaps, the first systems that show strain are sleep quality, energy, and sexual function. The good news, some of those gaps are fixable without prescription drugs. One of the most commonly overlooked is a basic mineral that quietly supports nervous system calm, deep sleep, and healthy circulation. The missing piece. Why men often lack this mineral. In clinic, I see a pattern. Older men who assume reduced energy or weaker erections are just part of getting older. But often there's a more correctable explanation. A deficiency in magnesium. Magnesium helps your body relax, supports deep restorative sleep, calms racing thoughts, and even helps blood vessels dilate properly, all of which matter for both sleep and morning function. Think of it as a calm-down switch. Without enough magnesium, your nervous system can stay in low-level alert mode. You may fall asleep, but you don't reach the deep stages of sleep that restore hormone production and vascular recovery. Over time, that shows up as lower energy, more nighttime bathroom trips, restless legs, and weaker morning function. The big mistakes men make and how to avoid them. Let's cover the 4 most common mistakes I see, and the right approach you can start tonight. Mistake number 1, ignoring magnesium altogether. Too many men assume they get enough from food. Realistically, modern diets and certain medications lower magnesium stores. If you're feeling chronically tired or noticing decreased vitality, don't just accept it. Investigate. Mistake number 2, choosing the wrong form. Not all magnesiums are equal. Some forms, like magnesium oxide, are inexpensive, but poorly absorbed and often cause digestive upset. If you want calming, sleep-supporting benefits, look for forms known for better absorption and gentle tolerance. For example, magnesium glycinate is widely used for relaxation and sleep, and magnesium threonate is often discussed for cognitive and sleep support. Always check labels and quality. Mistake number 3, taking it at the wrong time. Timing matters. Magnesium works by signaling the body that it's safe to relax. Take it in the evening, about 30 to 60 minutes before bed, with a little warm water or herbal tea. Taking it first thing in the morning tends to blunt the benefit and can feel like a drag during the day. Mistake number 4, expecting overnight miracles. This is not an instant stimulant. Magnesium works cumulatively. Most men notice more relaxed sleep in the first few nights, improvements in morning energy, and fewer disruptions over the first 7 to 14 nights. Stick with it consistently, and you'll see the trend. How to put this into practice. A simple night routine. Here's a practical, low-cost routine that many of my patients use. 1. Choose a good form. Aim for a well-absorbed form such as magnesium glycinate for calm and muscle relaxation, or talk to your provider about magnesium threonate if cognitive support is a priority. Avoid cheap oxide forms for nightly use. Second, dose sensibly. Start low and be consistent. For most men, a modest nightly dose is effective, but do consult your physician, especially if you're on medications or have kidney issues. 3. Take it before bed, 30 to 60 minutes before lights out, with a small cup of warm chamomile or plain water. Dim the lights, put phones away, and give your body a gentle signal, it's time to recover. 4. Supportive stack, optional. Some men pair magnesium with zinc and vitamin B6. The combination is sometimes used to support testosterone and recovery. Again, check with your doctor if you're on medications or have existing conditions. 5. Add a short pre-bed routine. Gentle stretching for 5 minutes, a calm breathing exercise, and consistent bedtimes amplify magnesium's effect. What to expect? Realistic timeline. Be patient and watch for signal improvements. The first few nights you may fall asleep faster and feel calmer. By the end of week 1, many men report better morning clarity and slightly increased energy. After 2 weeks of consistent use and better sleep habits, real shifts in stamina, mood, and intimate confidence are common. If you see no improvement after a month, talk to your clinician. There may be other factors to evaluate. A few safety notes. A couple of important cautions. If you have kidney disease, are on heart or blood pressure medications, or take other mineral supplements, talk to your doctor before starting magnesium supplements. Also, more isn't always better. Start modest, track how you feel, and adjust under medical guidance. Final words, this is not about chasing youth. I want to pause on this. Restoring sleep and recovery is not about pretending we're 30 again. It's about restoring dignity, confidence, and the energy to engage fully with life and the people you love. I have seen men in their 70s rediscover steady mornings, better intimacy, and more joy simply by prioritizing recovery and correct nutrition. So tonight, take a small step. Choose a quality magnesium form. Take it before bed, unplug from screens, and give your body the chance to reset. Consistency is everything. If this helped you, give the video a quick like. It helps other men find this info. Drop a comment below and tell me where you're watching from, or what recovery topic you want next. Sleep tactics, testosterone-friendly nutrition, or nighttime routines. I read every comment, and if you want more practical science-based tips like this, hit subscribe to True Wellness Network. You deserve better sleep. You deserve energy. You deserve to wake up feeling like yourself again.